Okay. Hi, my name is Peter Walker. I'm the voluntary sector representative on the Health and Wellbeing Board, and just reporting back on the last of the Health Wellbeing Board meetings held on April the 3rd. It was a public meeting, and again, mind that people can attend. Anybody can attend these meetings to hear it and see what's actually going on. And there's opportunities for the public to raise questions and present papers also to the board, again, which some groups may be interested in. Number of items on the agenda. It wasn't a particularly busy meeting in some respects, but some key items. There's been issues around young people in the city. It's been raised in the Joint Strategic Needs Assessment about the growth in the population of young people and the demands that makes on various aspects of city services. And one of the first items at the meeting was a report back on the basis of a report back stemming from requests from the Health and Wellbeing Board basically for reassurance that the various agencies in the city were working together on children's issues and the planning around the likely demands on services arising from the growth in the young population of young people were being addressed. So there was a report on that, and there was that reassurance, in fact, that work was being done and that the joint work groups were working together on joint work. So that was the first item, information item, and been various changes. One of Claudia McConnell, who was the Service Director for Children and Young People Services, has now left the council, and there's a new Service Director in post, John Redman. Next item was a presentation around the lottery money that the city has been given, just under £10 million over 8 years, to work with people with complex needs, homeless people, primarily people often in marginalised positions, suffering from or having experience of offending, perhaps experiencing mental health problems, substance misuse problems, as well as homelessness. The money has been awarded to Second Step as the lead agency, and who, part of the brief they have, is to involve various other groups working with this population of people to try and make a difference. And the big challenge that we heard in the presentation from Aileen Edwards, the Chief Executive of Second Step, and Nick Hooper, who's the Service Director at the City Council for a new title, Housing Solutions and Crime Reduction, was the need for cultural change, so that over this period of time that this group of people who are often seen as untreatable and excluded from mainstream services will be brought back in to mainstream services, and the new, it's called the Big Fulfilling Lives project, is looking at innovative ways of engaging people. One aspect of this is called a golden key, where certain individuals will be identified as having this so-called golden key, which will enable them to, with the cooperation of the various organisations, to have access where in the past they have been denied access to services. So it's going to be very interesting, and it's been incorporated to some extent in the mental health recommissioning. It's part of that to some extent, and certainly there's a clear interface with the changes in the mental health system to try and include this group of people. So, fulfilling lives. Watch this space as things begin to develop, and the board asks for further reports in the future about progress. Moving on, there was another presentation around the work being done in the city, around both in schools and elsewhere, about the strategy and the action being taken to reduce and address the violence against women. And there was a long presentation just showing what detailed work is being carried out to try and address issues of violence against women in all aspects of the city. And there's some interesting work going on, particularly in schools, where there is the thing called the Bristol Ideal, which is a project seeking to ensure that all primary and secondary schools in the city develop a whole school approach to tackling violence against women. So really trying at the very start to try and get, as I mentioned before, this sort of cultural change amongst young people, so that violence against women is seen as totally unacceptable, and that people grow up, both boys and girls grow up with that sense of the unacceptability of violence against women. So that was quite a significant presentation. Moving on, in Bristol, there's a report back on the issue of dementia and the strategy for dealing with dementia in the city, and obviously a recognition that dementia is a significant and growing issue, and coming from a place where basically feeling that dementia should be regarded as a disability in our society, that rather than assigning people to some sort of shadow land once they've been diagnosed with dementia, that we should begin to adapt our society to accept that dementia is a fact of our lives, that people can still lead very fulfilling lives in many respects, and that the problem is with our society and the way we do things rather than with the individual. Anyway, as an update on the dementia strategy, and obviously reporting progress being made, and again, part of the recommission of mental health services, it involves a huge component around dementia, and we'll be seeing that rolled out in the coming months. I think the NHS in Devon NHS partnership won the certainly preferred provider status at the moment in Bristol, so it'll be interesting to see how that works, that rolls out as far as the tender is concerned. A very brief update on the Better Care Fund. The submission has been made, and we're looking forward to future announcements around how that fund, in terms of the encouraging joint work between health and social care, will be rolled out. Next meeting is on June the 5th, and I think that's a public meeting, so everybody's welcome to be there.